Thanks everybody for joining the presentation today. My name is Fred Gaudia, Senior Account Director at Zeldis Research Associates, and I'm really excited to walk through some findings today from our most recent thought leadership project, Retirement Redefined, the Risks, Rewards, and Realities of Modern Retirement. We're actually conducting a webinar in two parts. There's a lot of really interesting data in this research. We're basically doing a presentation today with more of a focus on health findings, health insurance, healthcare type findings. Next week we'll have a separate presentation sharing some of the same slides, some different slides with more of a focus on our financial services and insurance verticals. So just for background, we at Zeldis, we're a full service market research consultancy. We specialize in insurance and financial services research. Been around since 1991, and every year we do some proprietary thought leadership type research with really just the goal of sharing some insights on curiosities we have with the broader research and insights community. There will be a video of this presentation after the fact, and there will be an opportunity for Q&A towards the end, as Brad mentioned. So the agenda, we'll share a little bit about the study, a little bit about the respondents. We'll go into some key findings with respect to Medicare first, healthcare consumerism, COVID, retirement, long-term care, and then we have a few profile slides towards the end. Like I mentioned at the outset, every year we do some research based on some thoughts that we have about just some things we wish we knew about as a company here at Zeldis, and we realized that we had kind of an unique opportunity to better understand sort of the 360-degree holistic view of the risks, rewards, and realities of modern retirement. So this is really we're presenting the findings from an online survey with 1,000 U.S.-based retirees, all age 55 and older. We thank our friends and partners over at Dynata who partnered with us to provide sample for this project. So Dynata is a very helpful co-sponsor for this research. Research was fielded relatively recently, but it seems like these days time is a bit of a construct, but it was fielded in May. You can see we collected data between May 5 to May 19 of this year. We prefaced the quant with a few qualitative phone or Zoom interviews with retirees to sort of help us refine our questions and refine our thinking for our survey. We're not presenting a ton of data from the qual in here. There are some quotes which we think are cool and interesting that we'll be sharing throughout the presentation. But again, primarily the results from this research are quantitative in nature. You can see on the right-hand side of the slide some important definitions. The most important ones for this presentation are at the top are age-ins. These are retirees that are not yet eligible for Medicare. They're between the ages of 55 and 64, of course, or you call them early retirees if you'd like, but we call them age-ins. At the bottom of the slide, you can see early Medicare researchers, average Medicare researchers, and late Medicare researchers. We thought it was important, particularly in that section of the report, to really cut the data based on when folks started exploring their Medicare options. And we did see that there were some people who were really early in the process, some people who kind of went at par, a year or two before they were eligible, and also those who were a bit later in terms of their starting to research Medicare. A little bit about the respondents here. Mean age 71. 97% of the retirees in this research are absolutely not working. The 3%, a small percentage, are doing some sort of gig work on the side, part-time work. We thought that was cool and have a few interesting bullets about them a little later in the presentation. 85% Caucasian, 15% respondents of color, 60% were married, with the remainder either divorced or widowed. We forced an equal split by gender, so 50-50, male versus female. About 7 in 10 had a household income under 100K at the time of retirement. That was 10 years ago on average. But at that time, the average respondent had under 100K in that year in terms of household income. Location, and 60% suburban, 20% urban, 20% rural, and at least 55% of the respondents in this research had at least a bachelor's degree. So the data is not weighted. We obviously always look at it with respect to representativeness and potential skew. We compared our data to some common sources and felt that we were in line with what you might expect. Again, this is not a Gen Pop survey. This is really a survey of those who have successfully retired. So keep that in mind as we look through the findings today. So our first big topic is a topic of interest, I think, to folks on this presentation. It's the topic of Medicare. Representative quotes precede many of the sections of the presentation today. On the Medicare section, you can see that one person that we spoke with in our qual said, "I was not knowledgeable about my Medicare options before becoming eligible. I am more knowledgeable now, but I am by no means good at it." We hear this type of logic really all the time in our qualitative interviews with Medicare consumers. Over time, they become, in a sense, facile with the process, with the coverage, but they know that their knowledge is not phenomenal with respect to what's available to them. We asked everyone who took the survey to take a quiz. We were presenting the results here on this Medicare quiz because we think they're more interesting among the retired age-in. So again, these are the folks under age 65. And you can see here that there are 5 true-false questions. There are the correct answers, of course, are on the slide. You can see, like, for instance, Medicare includes LTC coverage. That's false. And 18% of those who are not yet eligible for Medicare were incorrect on this. Medicare is free, false. 13% got that wrong, and down the list. So you can see that there are some relatively common misconceptions, misperceptions, I should say, of Medicare among those who are not quite yet eligible. These misperceptions tend to be focused, I would say, around LTC and Medicare Advantage plans. You can see that on the right, actually. We asked folks, in addition to the quiz, to identify the parts of Medicare, and you can see that most people got many parts incorrect. So there's some pretty high-level inability to understand how Medicare is structured and what it includes and what it does not include. Feelings about health insurance in Medicare. You can see that there's a pretty striking difference among those who are eligible versus those not yet eligible for Medicare with respect to understanding the difference between the different types of Medicare coverage and also the ease of understanding or the ease of transitioning from previous insurance to Medicare. So there's a clear gap, I would say, in both of these metrics between those age-ins and those over age 65. But clearly there's an opportunity even among those already on Medicare. We were a little surprised to see these top 3 box numbers, these agreement numbers, as low as they are, even though they're at 78 and 76% respectively. There's clearly an opportunity to improve those numbers among the 65 plus population, I should say. On the bottom of the slide, you can see there are some differently asked questions. We asked about cost with respect to health insurance coverage. And we can see some alignment both among age-ins and those 65 and older, some concerns about the cost they either will need to pay once they're eligible or that they currently pay for their health insurance coverage depending upon their current Medicare status. And we'll talk about some of these concerns about healthcare costs. That's actually a theme that we'll see throughout the presentation today. Some notable population differences on the right. I won't spend a ton of time on these just in the interest of time, but you can see that those with higher retirement savings are more likely to agree with nearly all these statements, and those who work with a financial advisor are less likely to be worried about the cost that they need to pay for health insurance. Current health insurance status, 80% of those surveyed are on Medicare. Within that, you can see a decent mix between Medicare Advantage, original Medicare combined with Medigap, and original Medicare only. Of the remaining 20%, and here I'm focusing on the left-hand part, that left-hand pie chart or donut chart, you can see that the remainder are in a mix of an individual market plan and an employer-sponsored plan, and some small percentage are on Medicaid or uninsured. The average age that a respondent in this research starts to explore Medicare options is 64. We think this is an opportunity for sure. Getting those who are aging in to start thinking about Medicare before age 64 would be helpful. It'll help them be more educated about it. It'll give them a stronger baseline, we think, when it comes to making a decision. So one key takeaway on this slide is that clearly there's an opportunity to get folks to think about Medicare at a slightly earlier age than when they're just months to come before they're eligible. Health insurance shopping behavior, primary sources of info on the left, 35% cite Medicare.gov, with 15% citing some sort of health insurance company, 14% using a broker or agent, and 12% using CMS.gov. You can see that on the right, 54% did not research or shop any insurance companies. This is based on those who currently have Medicare and who've been through a recent open enrollment, with the remainder doing some sort of researching and shopping. This is consistent with what we see in our research that we conduct for our clients as well in this space. The majority don't do any research at a routine open enrollment, and that's borne to truth by the numbers on the right, with 86% keeping the same health insurance company and same plan, and almost 9 in 10, 89% not likely to switch health insurance plans during their next open enrollment opportunity. Few opportunities here. One of them is that Medicare.gov is the primary source for Medicare information. We do often hear in our research that the website is difficult to navigate and that the information contained within that website is somewhat confusing. There's also an opportunity for health insurers, we think, to establish a relationship with members early on, saying things like, we're here for you now and in the future when you need Medicare. Some consumers who are not yet age 65 may not realize that their health insurance company offers Medicare plans. Selecting a Medicare plan, it might be the first time that folks have had to select their own plan. They don't really have the help of their employer, so they've got to think about things more on their own at this point. They seek guidance, they seek a trusted partner. Health insurer could position themselves in that role. One more takeaway on this slide. We realize this is a pretty busy one. Once Medicare members select a plan, they often don't switch. So it's important to transition existing members to a Medicare plan, and also to think about seeking out members of competitors' plans, because if you get them when they're first joining Medicare, there's some opportunity to keep them around for the medium term based on the data that we see here. Our next topic of the presentation is a few quick slides on healthcare consumerism. We did some standalone research in 2020 on the topic of healthcare consumerism, but in 2019, I should say, about healthcare consumerism. And with the pandemic-related events of 2020 and 2021, we felt that this was an opportunity to maybe do a quick refresh of some of the high-level findings from that research. Representative quote from our qual. Kind of a cool quote here from someone who's obviously a bit on the older side, saying, telemedicine, I love it. It works, it's on time, you don't have to sit in the waiting room forever. So, we came into this with some thoughts that there might have been a higher propensity of tech issues or concerns with respect to telemedicine among an older cohort, but really pleasantly surprised that that really wasn't too much the case. So here you can see on this very, very nice and detailed slide that 37% of retirees have already done telemedicine. Another 58% have at least heard of telemedicine but haven't done it so far, and really only 5% haven't heard of it. Much smaller percentages of folks, and we're not surprised by this data, provide physician health data from a smartwatch or a fitness watch, or talk to their physician about health data from a fitness watch. And only 4% use Lyft or Uber for their medical appointments. But some more on telemedicine. Let's go a little deeper into that 37%. 92% of retired users use telemedicine for the first time after the pandemic started. And additionally, 92% scheduled a visit with a provider that they already had a relationship with. Most often a primary care physician, although specialists, nurse, and behavioral health providers also receive a considerable incidence of being seen in a telemedicine setting. 66% use some sort of video platform, whether that was Doxy or BlueJeans or FaceTime or something of that nature. And really interestingly, at the bottom here, you can see on this call-out box on the left, 57% were extremely or very satisfied with the experience, with another 31% at least somewhat satisfied. So really, really interesting, I think, to see that satisfaction with telemedicine is high among a segment of the population that you might expect to be more adverse to it than younger folks due to technology barriers and just a desire for a more hands-on approach with physicians. But again, not really what we see here when it comes to telemedicine. Clearly an opportunity for those on the call who offer telemedicine services to advocate for the use of these services among older populations. Because it's not the case that every retiree is using it. It is the case that those retirees who are using it really are getting some significant value and some helpfulness from the process, for sure. Our next topic relates to the COVID pandemic, and the quote here from our qual is sad, for lack of a better word. One of the folks that we spoke with said that COVID hit and they spent the last year home by themselves. I think it's important in the slides that follow to think about the unique impacts of the pandemic among an older population. Obviously, before the vaccines, these folks were disproportionately likely to experience severe illness as a result of COVID-19, and lived in a way, for the most part, I think that was in a sense isolating for an extended period of time. And that brings us to the impacts of COVID. So you can see here that there's some resiliency for sure, but on the other hand, 37% of retirees report that COVID negatively impacted their mental health. 20% of retirees report a negative impact on their physical health, and 18% of retirees report a negative impact on their financial security. These impacts were most noted among respondents of color, particularly with respect to their financial and physical health, and age-ins, so those more likely than those 65 plus, feel that COVID took a toll on their mental, physical, and financial health. Keep in mind on the right-hand side of the slide, we asked this in May, before really Delta variant was in the news at all, and we found back in May that 32% felt that the pandemic would end within the next 6 months, so that would be November of this year. 40% believe that the pandemic would end by May 2022, and 28% think that it will take years for the pandemic to end. I don't know that anyone knows the answer, but it's interesting to see with the benefit of hindsight how some of these predictions sort of came to be. COVID vaccination status as of May, again, 88% fully or partially vaccinated, 2% not yet but plan to as soon as possible, 2% not yet, plan to at some point but waiting, and 6% not getting vaccinated, 2% unsure. So the fully and partially vaccinated number is a bit higher than what we've seen in other research. And in fact, if you look at the most recent data from the New York Times, who keeps track of vaccination percentages by age, it is the case that I think we're up to like nationwide 82 or 83% of those 65 and older in the United States are fully vaccinated. So our data had us at 88% a few months ago, probably just an example of people who take surveys maybe being a bit more likely for whatever reason to be vaccinated or to get vaccinated earlier. So interesting takeaway from that. You can see the reasoning on the bottom. For those who are vaccinated or plan to be as soon as possible, it's to be and feel safe and protected, for family, friends, and others, and to avoid getting COVID or getting sick. It's a small base for those not getting vaccinated, but you can see that of those 6%, 26% of that 6% say they're concerned about their effects, and 19% don't trust it. Another 19% say they don't need it, they're healthy. The final section of the main report relates to retirement, and we'll be presenting these findings with a bit of a flavor toward healthcare and health insurance as well. Representative quote here reads, "All I want in retirement is to be comfortable with my finances and my health and not have any surprises." And we'll see in the slides which follow that quality of retirement is inextricably linked with the quality of one's health and their lack of concerns about their health. What is the meaning of retirement? Kind of a high-level question to lead the section here. We asked respondents to select up to 3 things that retirement means to them. You can see that some of the top ones are really positive. The top cited items are time of leisure at 54%, an opportunity to spend more time with family at 39%, fewer obligations at 35%, and more time to pursue my interests and hobbies at 34%. It's interesting, however, to note that 17%, if you look at the bottom of the list, of retirees list health concerns in their top 3 items of what retirement means to them. Keep in mind, this is not a question about concerns. This isn't a question with a negative skew. This is a question that was asked in the most neutral way possible. The question specifically asked, what does retirement mean to you? It's really interesting to see that almost 1 in 5 retirees, their minds immediately go to health concerns when you get them onto the topic of retirement. And indeed, if you go deeper and ask folks who are retired about their top worries and concerns about retirement, you can see that the top tier items in red are all health-related. The most common worries and concerns that retirees have focus on health and the cost of healthcare. Going down the list to the items in yellow, or in orange, I should say, the second tier items, those are all financial in nature. So when you get to the audience of people who are already retired, it's pretty clear that from an attitudinal perspective, they're not as worried about money. They're worried about staying healthy. They're worried about staying alive. They're worried about sticking around to enjoy the merits of their hard work. It's interesting on the right-hand side of the slide that there are some concerns that become less versus more worrisome with age. Specifically, healthcare costs and choosing between healthcare options become less worrisome with age. On the other hand, not being able to take care of myself and needing long-term care becomes more worrisome with age. It's an opportunity, I think, for health insurance companies to help age-ins choose a health plan and start the conversation about long-term care, which will obviously become a bit more important as members age. Now, long-term care is obviously not a part of health insurance, but discussing it with members shows that a health insurer cares about their best interests and their future. One quick note on this slide before I move on. 45% of retirees have what they consider to be significant debt. There's a little bit of self-report in there, and we'll show that this is a pretty affluent audience in just a few slides, but you do see here that just under half of the retirees we surveyed have some sort of debt, whether it be credit card debt, a mortgage, or a car loan. Feelings about retirement are listed here, and this data is on a scale from 1 to 10. These are top 3 box ratings indicating the percent who agree with each statement. You can see that 92% agree that it's important for their mind and body to be active in retirement. 87% believe it's important for their estate to be in order before passing. 84% have 1 or more people whom they can confide in. 79% are optimistic about the future, and 76% agree that the age in which they retired was mostly up to me. You can also notice at the bottom of the slide that 35% of retirees are anxious about their health, and 20% sometimes feel as if they don't have control over the direction their life is taking, even though they're retired and theoretically have more control over the direction their life is taking than they had at any previous point in their life. Our takeaway and the opportunity here for folks on this call is that a health insurer can be an advocate for members to help them with their anxieties. Things that might be help off the top of our mind are proactive communications and preventive care reminders. Things of this nature can help retirees feel less anxious about their health and also give them some important control over their health. I think that makes a big deal and might potentially arguably have some positive health impacts in the long run, just giving people lower levels of anxiety. Plans for retirement. The most common plans, and these aren't already made plans, we're rolling up those who have done or plan to do these things. 92% plan to create a will or a living trust. 85% plan for unseen expenses that might happen in the future, with another 85% discussing end-of-life wishes with their family. Nicely, 65% are making significant travel plans to see the world. You should also focus on the middle slide, or the middle part of the slide about secondary plans, and note that 49% are downsizing their primary residence, and 49% plan to modify their residence so they can stay home. My takeaway from this is that about half of retirees are thinking about long-term care. They're thinking about the future, and they're trying to understand ways that they can extend the amount of time they stay in their primary residence, or at least do something as an accommodation to the future and the potential for less firm health moving forward. Retirement by the numbers. The average person who took this survey, the average survey respondent, started saving for retirement at around age 33. They felt their ideal retirement age would be about 62 when they were 25, and they met that. They retired from their last full-time job on average at age 61. For about half, they retired earlier than expected. 33% of retirees retired later than expected. Interestingly, those who were age-ins or early retirees are more likely to have retired earlier than expected. This might have been due to COVID or perhaps being offered a package by their employers. They may have also been less prepared for retirement when the time came. As we'll see, age-ins are more likely than those 65 or over to want to continue to grow their retirement savings. The average survey respondent retired with $750,000 on average. You can see some important differences by subgroup on the left. So you can see that the earlier you save, the more savings you have. Working with a financial advisor makes a difference. So those who work with an FA have greater savings than those who do not work with an advisor. Men have greater savings than women. Caucasians have greater savings than people of color. And the higher your income at the time of retirement, the more you have saved, generally speaking. You can see that there are some differences with respect to the level of comfort with retirement savings, surprisingly given how, frankly, affluent the respondent base for this research is. About 1 in 4 feel they have less than what they need for retirement. And if you look at the bottom left of the slide, almost 4 in 10, 38% of retirees say it's important to keep saving and growing their nest egg in retirement. You can see that, and I won't get into public policy in this presentation, but when you design a study where you're self-selecting in a sense for successful retirees, and still you've got numbers like the 2 data points I just presented, it shows that there is a notable savings gap in the country, and it's not necessarily being entirely filled by Social Security at the moment, most likely. Just a little bit on long-term care, and then we'll wrap up. Representative quote here is, I know I'm rolling the dice not having long-term care insurance, but we have no family history of anyone needing that type of care. We did some it's in a similar vein to the Medicare quiz. We did a long-term care quiz, and I realize there's probably not too many folks on this call who work for organizations that offer long-term care, but you can see that there was a very low level of ability to correctly answer our LTC quiz. There were 5 questions, multiple choice questions related to long-term care insurance. You can see that 77% did not get correct or did not correctly answer the question, which is closest to the average annual cost for a private room in a nursing home facility. 56% did not correctly answer the average cost of the home health aid to provide long-term care in your home, and 63% did not correctly answer the average length of time that someone needs care when they need long-term care. This data is all from Morningstar as of 2020. So again, starting the conversation about long-term care, regardless of whether or not it is a service that's being offered by your company, helping to educate members may help build a relationship and, importantly, demonstrate care for your Medicare members. So just an important thing to keep in mind, that there is a pretty big gap, and not just on this slide, but really throughout the presentation, with respect to awareness and understanding on long-term care options, long-term care costs, and frankly, the likelihood that long-term care may be necessary at some point in a retiree's future. Just a quick slide of interest. There's nothing really fancy here, but a few of the people that we spoke with when we were demoing out the presentation wanted to understand a little bit more about the early Medicare researchers. These are folks who began researching Medicare prior to age 63 with an average age of 59. So some of our clients who are health insurance companies came to us and said, what are these people like? Like we want to understand more about early Medicare researchers. So here are a few bullet points about them. These folks are significantly more likely than the late Medicare researchers to also be proactive about modifying their home residence. They're more anxious about their health. They started saving earlier for their retirement and consequently retired earlier. They, interestingly enough, had a lower income at the time of their retirement. They're more likely to be Black or African American, and they are more likely to self-identify as being very liberal. So that's just a profile of some information throughout the presentation about the early Medicare researchers. So it's a relatively short presentation. I know we booked an hour. We always like to get folks out of presentations a little bit early, but I'm happy to stay as long as there are questions. And you can also see my contact information on this slide. You can email me at fred@zeldasresearch.com if you have any questions that you don't feel like sharing in the webinar. Or if you'd like me to set up a webinar with your team, let me know. I'm happy to do that. We can talk about that as well.